Explain the procedure to the patient and gain consent. Gather your equipment of a stethoscope and a sphygmomanometer and appropriate detergent to clean the equipment afterwards. Check the equipment is ready for use and that the cuff size is correct with a bladder of 80% of the arm circumference and 40% of the arm length. Check the arm is free from clothing and level with the heart. You may need a pillow to do this. This also helps to straighten out the arm. Locate the brachial artery. Apply the cuff neatly around the bare arm, above the antecubital fossa, with the centre of the bladder over the brachial artery. Please note the tubes from the sphygmomanometer can be leading upwards towards the patient's shoulder or downwards. However, upwards prevents the tubing from interfering with the stethoscope. Ensure that the patient's legs are uncrossed and that the patient does not eat or drink during the procedure. Estimate the systolic blood pressure. Palpate the brachial artery. Inflate the cuff until pulsation disappears, then deflate the cuff. Take a mental note of the number at which the pulsation reappears. This is the estimated systolic pressure. Allow the patient a short rest before then inflating the cuff to 30 mm of mercury above the estimated systolic pressure. Position the bell of the stethoscope firmly but without too much pressure over the brachial artery. Inflate the cuff to your estimated systolic blood pressure value and then deflate at a rate of 2 to 3 mm per second until you hear regular tapping sound. These are known as Kortkoff sounds. Take a mental note of the first sound you hear. This is the systolic pressure. And when the tapping sound disappears, this is the diastolic pressure. Do this to the nearest 2 mm of mercury. Once the sound disappears, rapidly deflate the cuff.
Good, well done. You were very good at that, weren't you? Excellent.
Inform your patient of the results and leave the patient comfortable. Remove the equipment and cleanse this according to your local policy.
Put that pillow back up there.
Document the vital signs in the early warning scoring chart. Please note it's really important with children to ensure that you have the correct age group chart for them. Report any abnormalities to the nurse in charge.